Hi, my name is Shannon. I'm a student at Nova Southeastern University in the doctoral program for occupational therapy. I'm going to be working with you today. How can I address you?
Brooks.
Very nice to meet you. Okay, so today I'm going to be doing what's called internal and external range of motion for your shoulder, and so that's going to be doing this motion as well as this motion. And then I'm also going to be looking at the muscles in your neck for what is called cervical flexion. I'm going to be testing those muscles through what's called manual muscle testing to see how strong those muscles are. So first, what I'd like you to do is I want you to make sure that you tell me if you are experiencing any pain or any discomfort, because we'll stop right then and there and address it at that point, okay? I also want to let you know that I've washed my hands as well as my goniometer before we started this, okay? All right, so first I'm going to have you make sure that you're seated all the way, sitting straight up with no back on the chair, okay? And then bending that arm right there, 15 degrees of abduction here to make sure that he's in the correct position. And now if you will, just take your hand and point it in towards you. Good, that's internal rotation. And then if you will, pull it out towards me. That is external rotation. Very good, okay, you can relax. All right, so now I'm gonna be measuring that, okay? So for both of these, I'm gonna make sure that I have you all the way good and lined up. So if you will, right here, keep that back nice and straight for me. So my stationary arm is gonna be pointed out towards me. And it's going to be perpendicular to his body, and then my axis is going to be lined up under the olecranon of the elbow, and then I'm going to be running right along the ulna to the ulnar styloid. And then go ahead and take that in towards your belly, but do not touch your belly for me. There we go. Okay, so right here I'm making sure that I'm completely lined up, and then going to be putting it out this way. Again, parallel there. Okay, so now I'm getting a read of 44 degrees, which is good. That's it within the normal range. So that's going to be for internal rotation is 0 to 70. The internal rotators are going to be 5. It's going to be your pectoralis major, teres major, the subscapularis, latissimus dorsi, and the anterior deltoid. So now I'm going to be looking at the range of motion for your shoulder external rotation. So again, I'm going to be starting at 90. So I'm going to be reading the red numbers going around. My axis is going to be the same, and I'm actually going to get behind him just a little bit to make sure that I don't get in his way for this. Starting at 90, my axis is under his olecranon. My movable arm is going to be parallel here, and my stationary arm is going to be pointed out perpendicular to his body. Again, along the ulna towards the ulnar styloid process. All right, go ahead and pull that arm out this way, making sure to stay in that 15 degrees. Good, right there. That's good. Can you go any further?
No.
Okay. Making sure that I stay good and aligned with my axis, just like this. And then go ahead and you can go back to neutral. Very good. Okay, so now I am getting a read of 74. So that's really good because the normal range for external rotation is going to be 0 to 90 degrees. Your external rotators, there's 3 of them that are in that muscle group. It's going to be your infraspinatus, your teres minor, and your posterior deltoid. So now I'm going to take and be testing, like I was talking about, your neck muscles for neck flexion. So what I want you to do is make sure you're sitting all the way straight, looking straight ahead for me. And if you will, just take your chin to your chest for me. There you go, very good. Is there any pain with that?
No.
Okay. Okay, so now I'm going to be testing those muscles. What I'm going to be doing is I'm going to have my hand right here on his shoulder. That's my stationary hand, my stabilizing hand. And then I'm going to have my resistance hand right on his forehead. And now I want you to take and make sure that you're just doing exactly that same motion, pulling your chin down to your chest, not trying to extend all the way out, okay? All right, go ahead and push that chin down to your chest and resist me. Ready? 1, 1,000, 2, 1,000, 3, 1,000, and relax. Very good. Was there any pain with that?
No.
Okay, so he reports no pain, so that would be strong with no pain would be my report. So for both of these, for the range of motion and for the manual muscle testing, there is gravity reduced positions that I could put him in if he experienced any pain or wasn't able to perform them on his own. And so if he wasn't able to do the manual muscle test of the neck flexion, I would have him lay down for me, and I would again do that and move him through that motion. And then for the internal rotation and external rotation, I would have him lay prone on his stomach, put a towel under his shoulder, and have him do the same motions again. Thank you so much.
Thank you.